Medscape by Zachary. Utility. This app has information that can help you as you work in any healthcare facility. It can teach you about medications, conditions, disease processes, pathophysiology. It has a number of calculators for every different situation, from home health to ICU to emergency room to everyday med-surg calculations. It has medical formularies for when you get a doctor's order that doesn't match the formulary that you have within your hospital, so that you can find a drug that will provide the same level of care for your patients so that you can successfully put in an order. It also has continuing education credits that you can use for free, and downloading it on your Wi-Fi, you can use it offline anywhere. Usability. I don't like that you have to sign up for an account before you can use the app, but afterwards you don't have to sign up or into the account again. As soon as you open your phone's app, you're right into the meat of the application. It's easy to find everything within the app. It starts off on the first page with news, with the medical information, and continuing education credits. It has a logical placement of all of the information. You go into the medical section, it has the medications, it has the disease processes, it has the calculators. Everything to do with medications and the health field are in one place. You can use the search function, which is helpful within the medications, to find anything, whether you use generic or brand name, it'll pull it up, or you can look the medications up A through Z. The conditions and disease processes aren't quite as easy to use. They have categories that you have to search through to find the disease process that you want. Legal ethical. The liability issue with this app is that any adverse effects that happen with the patient while you're relying on the app are essentially your fault, as stated in the fine print of the application. This said, you should only use the app as a refresher for medication information and disease process information that you might need just a refresher on. Analysis. The continuing education credits are easy to use, and everything can be done through the app, the course, the test, and you can have the email sent to you from the app certifying you for the continuing education credit. The medication information is good. I haven't seen any errors so far with using the app in my own practice, and with the medical procedures, I haven't had to use that in my own practice, but just playing around with it, I feel like they should include different conditions in multiple categories so that it's easier to find what you're looking for. Conclusion. The app is reliable, and you can use the medication information quickly and easily, and without worrying about if it's going to be inaccurate or not, as far as your own refreshing information. Don't rely on it for brand new information about a drug that you have no idea what it is. The liability issue being the case because you don't want to hurt somebody essentially and then say, oh well, the app said this or that, because the app will not back you up.